Attention all veterans on a journey to reclaim optimal health and thrive in post-service life. Welcome to another instance where we dive into insightful topics and conversations that are tailored just for you. Today's topic is, as always, captivating with a promise to uncover powerful insights, expert tips, or even real-life experiences related to achieving optimal health for veterans. Get ready to be inspired, informed, and motivated as we explore the transformative world of primal wellness and its impact on your well-being. Whether you're a seasoned wellness enthusiast or just starting your journey, this discussion is designed to ignite your curiosity and guide you towards a path of vibrancy, vitality, and lasting health. Let's reclaim what we can of the state of your health when you were first enlisted. Let's dive in.
My name is Mylene T, and the objective for my presentation today is just to provide you with an overview of functional medicine, an approach to functional medicine care, and some of the things you've heard, like root cause medicine, I'll mention that. And then highlight briefly some health challenges for military women and women veterans, and we'll have time for some Q&A. So like Mitzi said, I love breathing deeply because it's just one of the best things that we have total control of, taking deep breaths. And I thought maybe I'd invite all of us to maybe sit back and take a nice deep breath. I always like to, breathe in, counting to 4. And when you breathe out, you count to 8. It's a great way to activate the parasympathetic system. It's a great way to help your body relax and heal. So I invite you to do that throughout our time together. So functional medicine is really root cause medicine. It's looking at, like the picture here, looking at factors that influences health, not just symptoms that often you may present with to your clinicians. So the root factors, and a lot of it include lifestyle factors, where how much sleep you get, whether you enjoy exercise, nutrition, your relationships at work, at home, in your community, whether or not you've been if you've experienced trauma. Microbiome is a huge factor in root cause medicine, and environmental factors. So in functional medicine, it's all about a system biology. It's looking at the whole person, understanding the interactions among genes, lifestyle, and environment. So the approach is very patient-centered. There's no cookie-cutter approach. It's all about the patient in front of us. And in functional medicine, we treat symptoms, whatever symptom you present with, whether it's poor sleep, pain, digestive issue, we would treat the symptom, but we don't stop there. We always address root causes. And oftentimes it's a multimodal treatment plan that would involve perhaps working with health coaches, which I understand you'll hear more about later today. For veterans, military veteran and veteran personnel, the operational environment oftentimes is the root cause of all dysfunction, if you will. The more austere environment, the polluted environment, disrupted circadian rhythm, not enough sleep, and then the diet that we're exposed to when we're deployed. So being in the military and being veterans, your exposure is quite different than the civilian population. In a system biology approach, it's looking at physiology and function, because one condition may have many different imbalances. For example, obesity. Obesity, or being overweight, could be due to inflammation. It could be due to hormone imbalance. There's a genetics and epigenetic interplay. It could be simply due to diet and exercise, or mood disorder. Depression, anxiety could lead to obesity. Likewise, one imbalance can cosmetic conditions. For example, inflammation. Having inflammation in your system can lead to heart disease, depression, arthritis, cancer, diabetes, and on and on. In functional medicine, we identify imbalances in three ways by looking at what we call antecedents, triggers, and mediators. Antecedents are factors that predispose you to an illness. So it could be genetic. It could be a methylation issue that you were born with. It could be a deployment where you were exposed to burn pits. That could be antecedents. Triggers are something that provoke the symptoms and sign of illness. In our population, for military personnel, that is often a deployment that is a trigger for pain, chronic pain, because of disrupted sleep, poor eating, carrying heavy equipment, and injuries. Mediators are factors that contribute to you staying sick, staying the way you are. And mediators are often what health coaches help our patients with, is to address the negative mediators. There are also positive mediators, and I'll talk about them later. So most functional medicine doctors use a template such as this, where we obtain a very detailed history that includes the antecedents, trigger, and mediators. So this is a picture of what functional medicine clinicians will use to assess a patient, is obtaining a very detailed history that include antecedents, triggers, and mediators, like I mentioned here's on the left. Also understanding personal lifestyle factors, which our health coaches are probably very familiar with, is sleep, exercise, nutrition, stress, and relationship. And as our patient present with symptoms, we try to understand where are the major factors of imbalance, whether it's digestion, assimilation, defense or repair, energy, biotransformation, transport, communication, or structure. That helps us figure out where to start. But knowing that the physiology changes can improve with lifestyle factors. So the upper part here are influenced greatly by lifestyle factor here at the bottom. So those are the key things from this chart. So this is a chart I'm put together based on working with military personnel and veterans, understanding where the most common antecedents for military personnel oftentimes are, there significant adverse childhood experiences, perhaps, or mandatory vaccination program that a lot of time a recruit come in and they get a lot of vaccine all at once, and they go to boot camp, where they're so stressed that cause such a disruption to their microbiome, causes IBS, and then while they're there, they're exposed to extreme physical stress that leads to chronic pain. That's a pattern I see quite often. Also, military personnel, when we deploy, we often prescribe antibiotics as malaria prophylaxis. We use doxycycline, so you're on antibiotics for a long time. That leads to disruption in microbiome. There's risk of allostatic load, carrying heavy equipment on our back, concussion, emotional and physical illness. So these are won't have time to kind of go over everything, but they're all common risks for military personnel. Likewise, even in the lifestyle factors, take sleep, for example. There was a study done by RAND Corporation that showed that on average, military personnel only sleep 5.7 hours, less than 6 hours. The recommendation is actually 7 to 9 hours. Sleep disorders very prevalent in military personnel, up to 85%. In terms of exercise and movement, while there are fitness standards, military personnel gain about on average 4 pounds and half an inch in abdominal circumference every year. And I think that's probably a lot of it is attributed to stress and the diet, right? There's the standard American diet, but there's also the military American diet. So there's SAD and there's what we call MAD, and they're meals ready to eat, MREs, are just very high in fat, salt, sugar, low fiber. And then because of stress, a lot of military personnel use caffeine, alcohol, and tobacco as a way to cope. Being enlisted military has every year has been ranked as #1 stressful job in the world. So, people are stressed. The good thing, despite frequent relocations that military personnel face and family separation, among military personnel, there seems to be a lower divorce rate. So that is protective. This is a infographic that was created by the American College of Lifestyle Medicine. I just want to highlight, it's a busy slide, I just want to highlight a few things. There was a study showed that upon entering the military, recruits are healthier than general population. It makes sense. You have to be healthy in order to join. But veterans, once you're done with the military, tend to exhibit equivalent, the same, or worse health than the general population. So when we enter the military, we tend to be healthier, but when we leave, we tend to be worse off. So what happened, right? So all the factor I mentioned. But I want to highlight here chronic pain. Pain is the most common complaint among military personnel, among service members, and 50% of men and 75% of women veterans report chronic pain. So pain is a huge issue. For military women, there was a study published in 2019 looking at military women compared to military men. Women have the same rate of physical illnesses and injuries to men. Women tend to use more medications than men. Perhaps we seek more medical care. Women experience more mental health issues than military men. And I wonder, there's so few studies specifically on military women, but I wonder if that's because of the disturbance of metabolic and hormonal dysfunction. Women in the military are usually of childbearing age. We menstruate every month, so the disturbance there have greater impact. So we are physically healthier than civilian women, but there's no differences in mental health. In fact, maybe worse off. In the same study, when they look at age group 30 to 39, women assess their health as poor twice more often than men. So I think women who are exposed to the physical and injuries have greater impact on mental health, and then have more adverse physiological outcomes. And women, older women, age 40 to 60, experience more musculoskeletal pain than men. Like I mentioned, chronic pain is a huge problem. So this is a slide that what I want to highlight here is that when we experience traumatic brain injury or present with PTSD, there's such overlap in complaint. And the highlight there is chronic pain, but people may just present with, you may just experience fatigue or a little bit of sadness and depression, and that could be part of PTSD or part of TBI. It is such a difficulty to discern. But what the military has recognized is that when you experience traumatic brain injury, that there's risk of hormonal imbalance, and we call that neuroendocrine disorder. That's what NED stands for. NED is neuroendocrine disorder. And there are things that your doctor should check. These are things I wrote down here: cortisol level, thyroid, a bunch of hormones, to make sure that the traumatic brain injury has not impacted your hormone. Couple of slides I want to share with you because it's something that in the military we've known for a long time, but I feel like I've not seen it made it to the clinical setting. And so this is a journal that's published, Military Medicine Journal, and they dedicated this whole entire journal that was published, 2006, to omega-3 fatty acid. And in this journal, the multiple study that show that supplementing with omega-3 decrease discogenic arthritic pain. It's definitely a safer alternative than non-steroidal medication, specifically for neck and back pain, because it decreases inflammation. And it actually even recommends for military optimal performance taking omega-3, EPA, BHA 1 to 2 grams daily. Vitamin D, there has been 19 randomized control trials. That's sort of our gold standards of medicine that show vitamin D supplementation improve pain score. We studied looking at veterans with complex chronic pain. So these are veterans with significant chronic pain, show that vitamin D supplementation improves pain, sleep, and quality of life. And that is the reason that is vitamin D modulates the immune inflammatory system. It decreases inflammation, and it decreases pain from becoming chronic. That's what chronic pain quantification is. So ask your doctor to check your vitamin D level, vitamin D25 hydroxy, and the optimal level is 40 to 60. Also, the role of vitamin C and chronic regional pain syndrome. So this is a very complex, difficult to treat pain, and there's studies to show that supplementing with vitamin C after orthopedic surgery decreases the risk of chronic regional pain syndrome. So if you ever need a orthopedic surgery, make sure you ask your doctor about vitamin C supplementation. That's really important to prevent this chronic complex pain. So in summary, functional medicine is the application of system biology. It's multimodal approach. Addressing the root cause is really the key in this approach, and addressing the whole person, and also include the mental, emotional, spiritual factors. We determine antecedents, trigger, and mediators, and to undo the root cause or address the root causes. And I know that functional medicine clinician can play a huge role in preventing and reversing chronic diseases. So ask your clinicians to explore and address root causes of any symptoms you may present with.
As we wrap up, I want to extend a heartfelt thank you to each and every one of you who took the time to listen and hopefully engage. Your commitment to your health and well-being is truly inspiring, and it's our honor to be a part of your journey. I also want to express our gratitude to our incredible contributors who have made this session possible. Their expertise and experiences have undoubtedly enriched our exploration of optimal health for veterans. Remember, your health matters, and together we're forging a path towards vitality, resilience, and thriving post-service. Stay connected, stay motivated, and keep embracing the power of primal wellness. Until next time, take care and stay well.